Hello, welcome to the Investor Voice. This is a KLAS Research podcast. I'm Justin Long, Director of Investment Advisory Services here at KLAS Research. This year, our podcast will focus on data and insights for our healthcare IT investor. We'll be covering several topics, with today's being a continuum of last week's on revenue cycle management, with the focus on clinical documentation and associated segments. I'm joined today by Mac Boyter, who is our Senior Research Director over several segments in RCM, and more specifically, patient financial experience, which includes patient financial platforms and patient financing services, which we know here at KLAS as far as HIM, which includes CAC, which is computer-assisted coding, CDI, clinical documentation integrity, and a few other adjacent segments, and of course, RCM services. Mac, great to be with you. Thank you for joining me today.
Thank you, Justin. Happy to be here.
Mac, as we look at healthcare, and specifically we're going to say our provider friends, one of the real pain points for them, or clinicians and physicians, is documentation. And there's not only short-term and long-term challenges they face, but as we know, there's a spillover effect that just impacts a lot of different things. Maybe in a more of a general sense, if you would you just maybe talk about the aspects of clinical documentation, and then maybe what are some of the market solutions that it covers?
Yeah, absolutely. So, and Justin, this is a very important topic, especially during COVID and the ongoing pandemic. This has become more and more salient. So thank you for taking the time. As we look at documentation, we're looking at different strategies or an ecosystem that really comprises documentation. Everything from, on one end, transcription services, scribing, whether that's virtual scribing, at the elbow scribing, all the way through to ambient speech type solutions, as well as coding solutions. All of this comprises basically taking an encounter with a clinician at a healthcare organization and taking that data, that interaction with a patient, some asynchronous or after the encounter, taking that data, making sure that it's extracted and transcribed or codified in a way that can be used to ensure patient safety, can be used to ensure that billing is done properly, and those types of very important topics. So that's what documentation really is all about.
So why is documentation so important to our healthcare organizations?
Yeah, I appreciate that very much, Justin. So documentation is critical for a couple of major reasons. The first one is patient care. Ensuring that the patient's encounter with a clinician or physician at a health system is documented in an accurate and timely way. In some of these cases, people are coming in, they're being seen. If that encounter is not taken and pulled out correctly and quickly, it can affect the quality of the stay, the interaction, the way that the health system will interact with that person, how they would discharge them, et cetera, or don't discharge them. So that's number one. Number two is for billing. Obviously, the health systems need the revenue. They need to get paid. They need to make sure that clinicians are appropriately compensated for their work that they do. And so this is very important for both payers who are paying those and then governmental sources. So this is where documentation really is most important, those two things.
Those two things, I think that's really helpful. Thanks for sharing. There's a lot of activity. This as we talk with our investor friends. I'm talking M&A activity, right, that's happening in this space. What are maybe some of the key innovations that are happening here? And then I would just say as kind of subsequent to that, where do you see some growth in this area?
Sure. So it has been, I think, again, the pandemic has highlighted the need for certain firms to have survivability. They are looking at how do we offer a breadth of services beyond our traditional roles where we might have been comfortable and had core competencies. So those firms are looking to do either organically develop their own solutions or inorganically acquire those solutions through M&A activity. And we've seen a couple of different ways that that's gone. We've seen some firms who acquire, other firms who kind of come together as a confederation or group to offer that deeper breadth of services. And so we've seen both of those happening quite a bit across the spectrum of documentation. And then we've also seen your other question about the opportunity. The opportunities really are around just that, like which firms are going to survive this process well and which are going to come out the other end stronger as a result of it. I think health systems have been more choosy with where they spend their money because as elective procedures dropped in the early days of the pandemic and then the ongoing waves, Delta, now Omicron, when we had this happen, suddenly health systems were saying we have to be very, very careful and judicious about where we put our dollars and our spend. And so it's made for a more competitive environment, but it's also made for a tougher environment for these vendor organizations and services firms to really play in those areas. So the firms that can demonstrate the most qualitative and high level of deliverables, they're the ones who are going to get the most considerations and frankly survive and do well.
So when you say these deliverables, so maybe as we say kind of the technological or service-based solutions, it's important to say that they have to be achieving outcomes, right? So what ultimately are they, what are they accomplishing? What are you seeing as far as maybe use cases there?
Again, excellent question. I think one of the major outcomes that health systems are looking for is how do we decrease physician burnout? This was even more top of mind during the pandemic and those early days, but then throughout the lingering nature of the pandemic, as clinicians were working inordinate numbers of hours, long hours, they were really struggling to find people. They even had some health systems where you've obviously seen the news where people didn't adhere to vaccine mandates, et cetera, and were let go. And that just put additional pressure on those folks that did stick around. And so as a result of that, I think decreasing clinician burnout, physician burnout, nursing burnout is very, very important. And that's one of the major areas of documentation. It's designed to remove the burden, that onerous level of burden from the backs and the shoulders of the providers and put it onto these technological solutions or put them onto other solutions that can allow them to have a better life and actually see their family once in a while.
I mean, these are highly skilled professionals, right? They should just be spending time in the patient encounter and improving healthcare, not necessarily bogged down in these, but it's happening.
Yeah.
Are the solutions that, you're actually, again, you're deep into the research and working with a myriad of different vendors. Are they making some inroads here with reducing that?
Yeah, very much so. And here at KLAS, we have what we call our Arch Collaborative, which is exactly designed. One of the major keys of that is how do we focus on that? And we have found that the impact of transcription services, the impact of scribing services, it actually has an appreciable, measurable, demonstrable impact on decreasing those burnout things. But then beyond that, there's other outcomes as well, which are financial. We'll have to look at the fiduciary outcomes. When something is not properly coded, then it can get rejected very, very easily. And so they have, the hospitals and health systems are very, very focused on making sure that delivering that quality of care, but then we have to have that outcome of that financial remuneration. We need to make sure we're getting paid for every part of the visit that we possibly can that is accurate.
That's perfect. And our research ultimately shows which vendors are really performing well, those that need improvement. I think as well, you've touched on documentation, but some of these kind of adjacent markets, if you will, right, or segments. Is there really a consolidated end-to-end right now solution that exists in not only in documentation, because I know there's prioritization, there's different facets there, but when we talk about scribing, documentation, when you kind of led the initial conversation, maybe just share that with our audience.
I appreciate that because right now, one of the things with the initiatives we're doing here at KLAS, and we're going to have this coming out in 2022, is a documentation ecosystem or strategies report where we're bringing together that continuum or that spectrum of what does documentation look like and the effects of that and the performance of those vendors. That report will actually go through that. But to answer your question more specifically, the goal of some of these organizations is to be that one hand to hold. And if you ask any healthcare CFO or CMIO, their goal is always one hand to hold. I don't want to have a plethora of vendors that I have to engage with them differently and invoice me separately and so on. What we haven't seen, however, is anyone who really stands out from the crowd in terms of offering multiple complementary different solutions, both in and outside of documentation. Because to your point, the revenue cycle more generally, there really are a few firms that try to do it, but we haven't really seen anyone that really just stands out completely head and shoulders at this point.
Okay.
It's still very much a best of breed, type process, and so that's important.
Point solutions still are ultimately succeeding in this arena. Okay. As far as, again, I have to ask this because investors are obviously going to be watching and listening to this. From an investor standpoint, maybe what questions should they be asking as they're looking at documentation, or again, maybe scribing or some of these other, you mentioned autonomous coding, and again, we can unpack a lot of this,
right?
But just maybe a couple of questions that they should be thinking about if they're looking at this space.
So if I may, as an investor organization, what you want to look for is longevity, right? Some of the things that we saw during the pandemic, like telehealth, which saw a massive explosion in adoption rates, et cetera, and certainly post-pandemic, KLAS has done validated research that shows that has changed the landscape, but we haven't returned back to the previous levels prior to pandemic, but we've certainly seen not what it was during the middle of 2020 and early 2021. Whereas if you look at documentation at the elbow scribes, which were fairly ubiquitous prior to, suddenly if you're in a small room with a doctor, the patient, and the third person, social distancing is impossible, et cetera, and that immediately has changed that landscape, and really forever. It's not coming back at this point. So people are looking for technological solutions, they're looking at autonomous coding, and that leads me to my second point, which is don't be focused on the overzealousness of some of these vendor organizations. We absolutely appreciate, but this is one of the things that KLAS is founded upon, which is to educate and to try to help and to dispel some of the hype that may exist around these solutions. And when you hear a lot of splashy press releases and people are talking about their series rounds of funding, et cetera, it becomes really easy to kind of buy into that process. The whole purpose of KLAS, and why I'm so grateful you're doing what you're doing, Justin, is we have data. We speak with these CFOs, we speak with these decision makers, we speak with these clinicians. We gather that data and can say, this is real, or this is not quite as real as they would hope. And by dispelling some of those things and disabusing the processes, it allows, we hope, investors, healthcare organizations to make solid, strong, longevity-based decisions, not just based on the latest and greatest.
You're absolutely right, Mac. I mean, I like to, you liken it to a lot of shiny objects that are out there. A lot of Maseratis, or at least wannabe Maseratis.
Sure.
We've got to lift up the hood and really kind of show what's underneath there, right?
And that's where KLAS comes in.
KLAS comes in, investors, providers ultimately rely upon us. A couple of questions I want to make sure I do ask before we conclude here is, and you did touch on it, but you're talking about some upcoming research. You referenced this ecosystem report, and you said in 2022, when can we expect that to be out?
So you're going to hold me to it, right?
I'm going to hold you right to the week and day. And if you do, remember, investors will hold you to that as well.
They will, absolutely, they should. So we're looking at Q4 of 2022, possibly Q1 of 2023. It basically just depends on the level of data we can gather. But it's going to be a very large, broad spectrum report. And then we have other reports, like for autonomous coding, for example.
Yes.
We have what we call spotlights reports, which are designed to be brief in nature, but they are focused on a specific vendor and a specific solution at a time. So though we've done over 100 of those this last year, and we're going to be doing more in those areas. So those are a great resource, we hope, because especially as these are nascent solutions or solutions that are not as mature, we want to be able to get providers, healthcare organizations and clinicians, providers, and investors actionable insights as early as possible that are validated. And that's the core, that's the key of those reports. And then we also have our annual Best in KLAS report, and then we have this coming up this next year, we'll have a CAC report, we'll have a CDI report, which is clinical documentation integrity. We'll have another outsourced coding report, which covers both pro-fee and inpatient, as well as offshore and offshore resources. So all of those aspects of documentation and a scribing report. So busy year for KLAS, a lot of stuff coming out this year.
Our investors that are looking at these, these segments will be excited to hear all of that. And then obviously we can bring them in and peel back the onion further if we need to, outside of just the additional data sets that you'll capture in these reports. In conclusion, let me maybe ask you this question. We're still in the pandemic, unfortunately. I hope we're on the latter part for our provider friends and our healthcare organizations. But as they continue to grapple with the effects of this pandemic, documentation I think is even more important than it's maybe ever been before. Why is that? Or am I off on that question? Maybe?
No, 100%. And I don't want to make it too, we always talk about the new normal and how things are different now and so on. And then in some areas that is absolutely the case. The short version is that documentation and the strategies of these encounters and making sure that we're taking care of the patient and adequately compensating the professionals and the organizations there is something that has become even more acute due to the pandemic, due to the reasons we talked about before, the social distancing, people expecting that, and then also the remuneration. High deductible health plans are being adopted at a higher rate than ever before, by some estimations as much as 15 to 17%. So healthcare organizations need to get that revenue, and how do they do it? They do it by documenting their encounters properly and making sure that they can get paid properly.
So a high demand, if vendors can deliver, at the end of the day, they're going to achieve great things with our provider community.
It's the hope.
Mac, thank you so much. Again, like I said, always a joy to have a conversation with you, to share some of these insights. For our investors, if you have any questions about what Mac has shared today in our conversations, or if you have any further data that you're seeking in any of the segments that KLAS is currently measuring and monitoring. Or most importantly, if you have a topic you would like to suggest for an upcoming episode, please feel free to send an email to investorservices@KLASresearch.com. And we look forward to you hearing our next podcast, which will be on PACS and imaging.